And with both sides of Congress meeting today on the issue, the main question has to be, can they come to an agreement?
Yes, and that's certainly been the issue from the very beginning. But why? Congressman Michael Burgess of Texas's 26th District joins us now live from Washington, D.C. Congressman, good morning. Thanks for getting up early with us.
Good morning, sir.
Well, we just mentioned how tough it's been for lawmakers to get on the same page with health care coverage. What's the biggest hurdle as you see it right now?
You know, the real missed opportunity was this meeting is exactly 1 year late. Think if this meeting had been held in February of last year, before we all got into these entrenched positions and we got this far into the process. What a difference we could have made in the world. But we are where we are, and as you know, both sides are pretty much have their issues defined. There's a lot of incompatibility there. The problem that the president and the congressional Democrats have right now this morning is they don't have popular support. They don't have the American people behind them. It doesn't matter that they don't have Republicans, because they don't need Republicans, but they don't have the American people behind them. And as a consequence, they choose to blame Republicans. This is a good step that everyone's getting in the same room, so perhaps we can get past that talking point. But realistically, we should go to those things that the American people want us to do: fix pre-existing conditions, fairness in the tax code, portability, yes, some tort reform, and show some value on those areas before we try to take on this big behemoth of a 2,700-page bill.
Well, you've said, Congressman Burgess, this is nothing more than a 6-hour photo op. What do you hope comes as a result of this summit? Because it's going to happen.
It is going to happen, and I hope this is the initiation of some talking. Both sides are talking to each other rather than past each other. But there is no way you're going to reconcile the differences that exist across the aisle in a 6-hour photo op, which really is what this is. But if it is the initiation of further discussions, if we decide from this, maybe there is some common ground here on pre-existing conditions. Maybe we can do something. Boy, a mandate in a free society, we're talking about a big change for the American people, and they're not there. They don't want to do that. How could we get something that looks more like what they want: more people covered, more people with insurance, and doesn't sacrifice fundamental American freedoms? That's really the task that's ahead of us.
Congressman, finally, what's your message to the millions of Americans who desperately need health care, while Republicans and Democrats continue to fight with no compromise?
Well, bear in mind that scenario does not occur often. We do have a provider mandate in this country. Anyone who shows up to the emergency room gets care. I know that because I used to get those calls at 3 o'clock in the morning. But that's not a good way to get care, and we all know we can do better than that, and we all know we have a great health care system, and it's a distributional issue. It's a shame we don't let the knowledgeable people in the room to talk about this, but we have what we have, and the president has reached out to Republicans. The Republicans have responded. This is a good thing on both sides. Give them some room and give them some space, see what they come up with today. I think the most important thing, though, is if they continue to talk past this point. If we see this bill pushed through quickly after tomorrow, then we'll all know that no one learned anything from this exchange.
Okay, Congressman Burgess, thanks and good luck, and we appreciate your time here. Well, of course,